So our rehabilitation goes through 3 phases. Our first phase is to reduce the pain. So we have to consider painful inhibition throughout the hip. So you have painful front of the hip, side of the hip, back of the hip. A lot of that has to do with the psoas. So today what we're gonna do is work on soft tissue release around the hip. We're gonna do some hip mobilizations that you can do at home. And then in phase 2 and 3, pretty quickly, we'll progress into that left leg strengthening, which is really the root cause.
Now, I just want to say I did play soccer twice this weekend. Probably didn't stretch. I did a little bit of stretching.
Yeah.
Realistically, do you think I should be shutting that down?
Yeah.
Okay.
For best results, for fastest results, you want to shut the soccer piece down and go with some low impact. So keep moving, keep active, but go low impact until we have this under control.
Okay.
Okay, so here's where we're gonna start on this list. Soft tissue, we're gonna work on the glutes. We're definitely gonna hit that psoas. That's a big challenge for you right now. And then if we can get this set up at your house, the best thing to do are some banded hip mobilizations, which we'll roll through. And finally, strength, really focusing actually on that left leg strengthening. So it's gonna come up all the way into that greater trochanter there. So you wanna make sure you hit the side. So you could roll on the side, or you could expose a little bit more superficially, bring it to the surface, and then roll on those tendons out.
Right.
This is the so right. So there's a few different versions. There's a so right that's upright like this. That'll get the psoas even more. And then there's the hook that gets, it can be a little more customized and into the iliacus. This is the less expensive form, but works great on psoas, which yours is very hypertonic and tight. And the hook just has a little different angle to it. So like, don't put it too low because it'll hit the bones of the pelvis.
Yeah.
You want to put it a little higher because interestingly enough, the psoas attaches into that lumbar spine right there. So that's where you're going to head. We're going to be doing joint mobilizations for your hip in clinic here when you come in, but it's going to be helpful for you to have a tool at home and also just be able to make some gains in between our sessions.
So like the red bands that I have, not near enough tension.
Yeah, those are too thin. So you need, for the hip, you need this guy.
Yeah.
Okay. So the first one, remember your hip flexion and extension, also abduction were very, very limited, and your internal rotation.
Yeah.
But your external rotation was good. So we're gonna get some movement out of that hip. All right. And this is just for the right hip. You're gonna slide it up, get that band in an inferior pull, back up as much as you can. So you have to think about where you're gonna anchor it at home. And then what you're gonna do is pull this in, and what it's gonna do is create the accessory glide of the hip, which is to pull down as you pull your knee into the chest to get a little extra room.
Explain one more time what accessory glide of the hip is.
Yeah, so in the world of joint kinematics, when you have this type of a joint, the convex joint, in any movement, it glides the other way. Okay, so when we flex, it's gonna go back that way, and I'll take you around because we need to get hip extension. Yours is very limited. There's an associated anterior glide with it. A lot of the videos on you show it the wrong way, but oops. So again, you want to pull it up as high as you can, and then hands and knees to back up because it'll fling you forward. Okay, lots of tension, and then you're gonna push forward. If you feel like it's too loose, you back it up because you really want to feel the band pulling your hip, gliding and sliding that joint to help with the full hip extension. It'll feel like a hip flexor stretch, but extra, like right through here.
Mm-hmm.
This final one is for abduction, and we're going to use a little distraction on this. So you go into a hands and knees position. You're going to pull it up as high as you can again, okay? And then you can pull away like this, a side bend. So I'm getting abduction. To the main problem, which is your ability to load the left leg because of that old ACL. And so we want to balance these two hips out ultimately to create a long-term solution. So we'll try first, see if we can get you up onto a slider. So a slider will help with assisted squats. We'll go straight into more of a hip hinge strategy first. So I call them take your mark sliders. So what you're gonna do is you're gonna think about single leg squat on the left. This is just lightweight or as needed to get some depth out of this. So we're gonna go here, put the weight forward, and then come back up. Just start with that. I'm using a hip hinge because it's a little less on the patellofemoral joint itself, but later we're gonna wanna load that a little bit more too.
What I've defaulted on doing is not doing any single leg lunges because of the crepitus. But this tool, the slider tool, actually gives you the confidence because you're working the other side to balance it out.
Yeah, and
So I'm getting the load with, and now I felt a little side crunch there. So you just sort of also works your balance slightly because I'm having a balance between the two so that I'm not overloading this to get the crepitus.
So what everyone needs to know is you might get some diagnosis of arthritis in the knees or something like that, and it'll feel like a grinding, popping scenario. But the great thing about it is that you can create exercises that give you to a certain amount of load where you barely feel the crepitus. What it's telling you is it's overloading the joint, but you can work up to higher loads, and that will reduce that snapping, cracking, and popping. And for athletes, if you're continuing to play soccer, we have to be able to load that leg.